Can LPR cause chronic bronchitis? What's the link? Imagine a tiny flame flickering in your throat that you might not even notice. That's what happens with laryngopharyngeal reflux, or LPR. It's a type of acid reflux where stomach contents travel upward past the esophagus and reach the voice box and throat. This can cause more than just a sore throat. It can actually lead to long-term issues with your lungs and airways. When stomach acid reaches the larynx and the back of the throat, it can irritate the delicate tissues there. These tissues are more sensitive than the lining of your stomach or esophagus. Over time, this irritation can cause inflammation that spreads down into the bronchial tubes, which are the airways leading to your lungs. This ongoing inflammation can develop into chronic bronchitis, which is characterized by a persistent cough and mucus production. Another way LPR can influence bronchitis is through microaspiration. Sometimes, small amounts of refluxed material are inhaled into the lower parts of the lungs. This process introduces acid and digestive enzymes into the bronchial tubes. These substances can cause inflammation and even infections, both of which are key features of bronchitis. The acid exposure from LPR also activates sensory nerves in the larynx and airways. This nerve activation triggers a cough reflex. A cough is a common symptom of bronchitis and can become a cycle. The more you cough, the more your airways get irritated and inflamed, making the cough worse. Unlike typical acid reflux that causes heartburn, LPR often doesn't show obvious digestive symptoms. This is called silent reflux. Because it lacks the usual signs, doctors might not immediately connect it to respiratory problems like bronchitis. That's why it's important for people with persistent coughs and mucus to consider LPR as a possible cause, especially if they don't have other risk factors like smoking or exposure to pollutants. Diagnosing LPR involves examining the throat and larynx, sometimes with specialized tests like pH monitoring to measure acid levels. Treatment usually includes lifestyle changes, such as avoiding spicy or fatty foods, losing weight, and not eating close to bedtime. Doctors may also recommend medications that reduce stomach acid or, in some cases, surgery. By controlling the reflux, you can reduce the inflammation in your airways. This can help improve or even resolve symptoms of chronic bronchitis caused by LPR. Recognizing the connection between acid reflux and bronchitis is key to getting the right treatment and feeling better.